Well, hi, and welcome to episode number 6 of Ask Us Anything. I'm Mark Graban, the VP of Improvement and Innovation Services with KaiNexus, and I'm joined by Greg Jacobson. Introduce yourself.
Hi, I'm Greg Jacobson. I am the CEO and one of the two co-founders of KaiNexus.
Greg's also an ER doc, which is, I think, a doubly interesting part of his background and professional life. So the first question, it wasn't one that anyone asked us, but people might be wondering, Greg, how do you balance running a startup company and being an ER doctor? How do you juggle that?
Not well. Is that the
it's your answer?
You're looking for? No, it's funny. So fortunately, emergency medicine affords me the opportunity to really scale up and scale down my practice. So I basically have found a really great group here in Austin, ESP Partners, and standing for Emergency Service Partners. And they allow me to work a couple shifts on the weekends. So now I'm doing 2 shifts one weekend over at the main tertiary downtown hospital seat in Maine. And then I'm heading one weekend to go out in a more rural community. I'm just south of Bryan College Station in a place called Caldwell, Texas, and I'll do a 24-hour shift there. And so it really gives me a really great balance of some kind of inner city medicine and some tertiary care medicine, but as well as really enjoyed working out in this rural hospital. I just did not realize how much I was going to enjoy that. And the folks are just really super helpful. That system is out of the St. Joseph system in Bryan College Station, which, by the way, is just doing great continuous improvement and great lean work. The CEO there was on the panel at the Lean Transformation Summit back in Dallas last year, throwing out props. KaiNexus will also be present at the one this coming year up in Miami. I think that's what, the 14th and 15th, or
it's about June 15th, middle of June in Miami.
Great 2 days of learning and sharing there. So if you haven't scheduled your conferences, other than the KaiNexus conference, which will be in Austin in November, that would be one I would definitely put at the top of the list. So I think I'm doing a nice job balancing it. I sometimes don't look forward to the weekends where I'm having to work 7 days, but as soon as I start practicing medicine, the time just escapes, and I love it. So,
all right. So the first question that came in from the audience, Larry asks, given that there's proper support from upper management, what are the most common pitfalls that come with lean or continuous improvement? So maybe let me touch on that first. I think it's great, even necessary, to have upper management support for lean or continuous improvement or whichever of these methodologies. But a lot of it really lives or dies based on the habits, the behaviors of the frontline managers. So it really requires support, aligned support, common behaviors with different types of support from the executive level, from middle management, from frontline managers. So you could ask this question in any direction. If you have support from frontline managers, what are some of the pitfalls? It could be that executives aren't on board, that executives aren't supporting a continuous improvement culture. You really need everyone leading.
Yeah, I think that's great. And I'll add maybe a little bit more kind of spice to that answer. I think one of the things that we've learned a lot with working with KaiNexus customers is, one, there's really top-down work, and then there's bottom-up work. I think if you look at any type of improvement work, you can probably categorize it in one of those. So when we're looking at organizations that have done a really great job with continuous improvement, as defined by everyone helping to improve the organization every day, what you find is the simpler you can keep the bottom-up work, the simpler you can make it to allow people at the front line to participate, the greater the chance that they're going to participate. What's interesting is we're trying to balance a lot of that top-down work as well with our customers. So we've ended up kind of in this rock and a hard place sometimes, because as we're engaging with the new customer, they obviously have realized the benefit of managing this stuff electronically. They have a lot of really complex top-down type of stuff. And trying to kind of balance that in one environment where you can even let frontline staff participate in the top-down stuff is what makes our job really challenging, and one of the things that we love about it. But take home, keep it simple, stupid.
Yeah. So here's a question that comes from Heike. Hope I'm saying the name correctly. I'll keep saying it until I do. How do you find the optimal balance between flow efficiency and resource efficiency? So let me touch on that first, both maybe historically and current day. So resource efficiency, we talk about efficiency, we're usually talking about the utilization rate of a person or a machine. Traditionally, organizations have really focused on high utilization of resources. Keep every machine busy, keep every person busy. This is often driven by cost accounting measures and just traditional mindsets where managers don't want to see people not doing something because they think we're paying for people, we're paying for equipment. We got to keep it running to make it worth its while. But there's false economies with that. If you keep a machine running in manufacturing just to keep it utilized, you end up building up inventory. You might be building waste. You're going to have quality problems, overproduction, lots of wasted motion. So one of the key insights of Lean is the idea what really matters more is flow efficiency. How are products or patients in a hospital flowing through the process? And as an industrial engineer, we're taught, when you look at something called queuing theory, looking at flow through systems, if you insist on resources being 100% utilized or even 90% utilized, flow almost grinds to a halt. So there are trade-offs. And Lean tends to focus more on flow efficiency. And so, I think we look in healthcare settings, that's a lesson for Lean in healthcare. Look across the value stream, and there may be a time when the best thing for flow is to have some excess capacity, which means people or machines might be idle. And that freaks people out because it's easier to see a machine or a person not working than it is sometimes to see the bad flow. So Lean definitely puts the emphasis more on flow efficiency than resource utilization.
It's an interesting question. Can you repeat? I just want to make sure I understood the nuance. Can you repeat the question, Mark?
Well, so they did elaborate. So the optimal, how do you find the balance? And so maybe I'm saying maybe the balance is more toward flow efficiency, but you said maximizing the flow, which may require lower resource utilization, or maximizing resource utilization, which may lead to bad flow.
Right. So I immediately was thinking about the emergency department because that's a major issue we have in the emergency department because you cannot schedule patients. Although there are some products and services out there that do allow you to schedule an appointment at an emergency department where you can, there's one that's being used by Seton here, and you can kind of see a little bit, kind of guarantee being able to be seen by a doctor within a certain period of time. But I always really struggle with that in the emergency department because if you have tons of people there working, then oftentimes people are going to be sitting around because patients are coming through the door, and then all of a sudden there's a spike at an expected time. So I guess I would probably add two things. One, it goes to the question that Mark answered before. It's really the middle manager or that frontline manager's habits are key to driving continuous improvement. Okay, so why am I bringing that up now? Because in an emergency department, if we're going to use this as an example, and I think you could probably apply this to any type of a company. I'm just doing the emergency because I'm an ER doc.
Yeah.
That's a great time when things slow down to go to the idea board, to open up KaiNexus, to take a look, get people's feedback, and to sift through some of the improvements that they're going with. And so just keep that in mind, that there's great ways to utilize your talent, your frontline folks, versus just sending them home early.
Yeah. Well, let me touch on that point real quick. Sorry. So, I hear people complain all the time in emergency departments when leaders are chasing resource utilization, labor productivity. They'll say, okay, we have a lull in the ED, we send people home, and then sure enough, bam, here comes an unanticipated spike in demand. Right. And they're scrambling to call people back in. What you propose is the Lean alternative. When you have downtime, use that for process improvement, Kaizen, education, instead of just trying to chase labor productivity every hour. That's, if you look at what Toyota does, if their line goes down, they never send people home early. Now, are they wasting money? No, they're using that time wisely. And that's, I think, a great lesson that hospitals could learn.
And so I think I'm going to make one more point on this and then we can move on. Unrelated to the first observation that we just discussed, one of my mentors had a saying that he would say frequently, and it's something that I practice with, but err in the way that the patient suffers the least. Mm-hmm. Okay, so what is that really saying? It's really saying, what is the mission of your company? What is the mission of your work? And make sure that whatever decision, whether it's resource, or whether it's flow, whatever is going to drive the principle of why you're there, better err in that way. So for us, if I was going to say, well, I don't want a person that's having a heart attack sitting out in a waiting room, right? Well, then I'm probably going to go ahead and err toward overstaffing a little bit, and I'm using the word over with quotes. Staffing with ways that would protect being able to see patients quicker versus erring in the other way. So figure out what's a core competency or core mission for your company, and then make a decision that errs in a way to support that core competency. So,
yeah, and I think perfect scenario in the ED. The one example, and we'll move on to another question I think of, is the fire department and EMS. We don't expect fire departments to be putting out fires 100% of the time. You could call it overstaffing. You could call it flex capacity or surge capacity, or just, capacity. There's more to life than just keeping everything 100% utilized. We had another question that came in, lost track of who this was from. What roles within the organization are most critical to spread a culture of continuous improvement? Greg, do you want to share some thoughts on that first, maybe?
Sure. And not to be flippant about this, but I think every role is, right? I think that continuous improvement culture inherently means that everyone is working in their appropriate role to do that. So you have the frontline person is engaged, understands what their strategic principles of the organization are. They are putting ideas up. They're participating in the implementation and completion of those improvements. You have a middle management that is working on creating a daily habit of discussing, of problem solving, of enabling. You have a process improvement team that is making sure that the middle management is well educated and has a clear path of what they're trying to do. And then you have senior leaders that are, giving us a vision to say, this is how we're going to get better in the next day, week, month, year, decade. Mm-hmm. So I really think that that the answer is everyone has got to be optimizing. It's kind of like saying, well, what person in a football team or on a basketball team is the most important? Well, they're all, because if someone doesn't do their job, then the team isn't going to win. So. Yeah.
And there's all these different roles, and people often ask about the role of a continuous improvement department. I was trying to emphasize, maybe this sounds obvious to the viewers. The role of the continuous improvement department is not to come up with all of the ideas and to drive all the improvement. I think the role of the continuous improvement department is to teach methodologies, to coach people, maybe to help track results, things that are more around education and administration, as opposed to actually doing improvement. And there's some people get kind of caught in the trap of being brought in, hey, I want you to come in and fix that problem for me, instead of being brought in as more of a consultative coach in the organization. So
we're working with a customer right now, and there was another question I think that came through. We might get to it today or in a future episode, Mark, about engagement. How do you measure engagement? And we have particular ways that we measure it with our customers, and the product helps define that. But this customer's engagement scores are absolutely through the roof. and I think she's doing just an amazing job at her job. I can guarantee you that her time on actual doing improvement work is a very small percentage, and that she's focusing on being a coach and giving energy into the system of all of the people that she is leading in through the continuous improvement effort.
Yeah. So that's a great Toyota-ism. The role of leaders is to add energy to the system. I've heard that from Gary Combis, who used to be at Toyota. But I was going to ask you to follow up when you talk about engagement scores are off the roof, through the roof. Is that through surveys, or is that through the data they see in KaiNexus?
Yeah, so in this case, it's a KaiNexus customer. So we actually have a suite of reports that can give you real-time engagement insights. So some of the ones that we look at that we think are really important, and we're constantly learning from our customers and adding more, but it's what is your number of improvements per person annualized? We love to see numbers above 1 and 2. In fact, we have some customers that are above 10. And then what is the percent of engagement of people using the system? So we can actually, once you go out of the Excel spreadsheet into KaiNexus, we can start running reports on, well, are people submitting ideas? Are they involved in a team? Are they commenting on something? And you can immediately realize, just by figuring out a user profile and figuring out, are they logging into the system? You can all of a sudden get real quick insights into what true engagement is. And so those are some of the different types of engagement scores that or engagement insights that we can give in KaiNexus. And then you can actually break that down into different locations and different departments. So we have a lot of our, for example, the one leader I was talking about, we have dozens of those leaders that are doing great work. They'll actually really spend their times on places that their engagement scores are low. And they know that they need to add more energy into this part of the organization.
Yeah. All right. So we had another question here from Ira, maybe more pointed at me as an industrial engineer, but it says, lean initiatives can result in either raising or reducing the level of risk for ergonomic problems, musculoskeletal. Did I even say that right? Musculoskeletal?
Musculoskeletal, yeah.
Musculoskeletal. Ask the doctor. So I say, for example, doing better tool storage locations eliminates wasted awkward motions to retrieve tools, but reducing occasional wasteful walking to go get tools and supplies can remove a physiologically effective break from static standing or sitting at a workstation. Any comments on how lean and ergonomics can be applied together? So, I started my career, I'm an industrial engineer. Even before GM was really embracing lean, I got sent to ergonomics training, and a lot of the projects I worked on in support of the production team was to help make ergonomic improvements, to analyze jobs for ergonomics. And I think what we often see, I think in traditional manufacturing settings, you tend to see very static jobs, except for maybe, like I said, I'm chasing parts, I'm running around and looking for tools. What I've seen in a lean environment, when you start breaking down, instead of one person doing the same job all day long, you have more job rotation, which is good from an ergonomic standpoint. You might not be running around racing for tools, but people might tend to work in more of a cellular layout. So you're not just sitting, you're not just standing, you're actually moving and staying kind of active, not overexerting yourself, but staying active. So I think what I've seen lean methods actually improve ergonomics, and that should be a key area of focus. Now, if we look in healthcare, nurses, I'll use just for example, are on their feet all the time. I heard somebody the other day was talking about in their organization, they were trying to increase the amount of walking around for the purposes of fitness. I'm like, well, all that shuffling around at work is not really exercise. It doesn't get your heart rate up. It just tires you. And so I think in lean healthcare, we're trying to reduce wasted motion. And in most jobs, you're never going to be fully stationary. That's certainly not the goal.
So I think this is a really interesting question, and I'm gonna kind of dig into it a little bit. So it's recognizing that there can be positive side effects to waste. Essentially, is what it's saying. That perhaps if you make your job much more efficient, you'll move less, and maybe that's the wrong thing to do. One of the corollaries with the ER is abdominal pain is something we see a ton of, and it's actually really complicated. One of the things for abdominal pain that's really great for an ER doctor is to see a patient in time, to do multiple exams to see if things are progressing. So in some ways you could argue that the inefficiencies of an ER, that the side effect for abdominal pain is that we actually get to see the patient for a little bit longer versus, kind of in and out, thank you, wham, bam, which might be great for like a broken arm where you're just like, oh, we can diagnose it, fix it, get them, more comfortable and back out on the street. But what I would argue is that that we should not in any way, because there's a positive benefit for something that's negative, that's not a reason that we should not take care of the thing that we should be doing, which is eliminating waste. And to me, I would rather see someone say, hey, if really the job is very stationary, then build in a 5-minute period every hour where the person gets up, does a lap or is, kind of moving the blood from their legs. And I would say that the kind of exercise that really is going to help you physiologically, and I'm just reiterating what you reiterated, Mark, is the type that's really going to get your heart rate up. You're going to sweat, go run, go to the, workout place, go play some squash like I do. That's a far better way to get some exercise than to build in or not fix inefficiencies in the system. That's just to kind of follow up and kind of close out that last question, that I think probably there's a benefit to all kind of errors or inefficiencies or any situation that shouldn't have happened. There's probably a benefit to in some way. That doesn't mean you shouldn't do the right thing.
Right. Now, to your point, I think, like you're saying, not all motion is bad. I would say not all time in a chair for a patient is bad. I would say, the goal is to reduce length of stay in the emergency department and to improve flow. Right. But I think there's intentional waiting versus unintentional preventable delay. So there may be times where, say you look at in a lot of processes, or I think about aging whiskey. Alan Wilson, who's been a great advisor to KaiNexus and to Greg, he's Scottish, and he says, the only time inventory is value added, that time in inventory is value added, is wine and whiskey. Because it's not just sitting, it's changing, it's transforming, it's getting better. And, there are times where, let's say, I imagine you may have to give a medication and wait to see the effect. That wait is arguably part of just a built-in part of the value-added time, as opposed to being a preventable delay. We're not trying to push patients out too quickly. That would violate that principle you talked about earlier about what reduces suffering for the patient. Pushing them out too quickly because we have some measure that we're trying to hit instead of doing the right thing for the patient. We want to avoid that.
I really like that question, Mark. That was a great question. Yeah.
All right. Well, I think we can do a couple more questions. Here's a quick one, interesting from Juma. Do you have some thoughts about job searching using lean principles? And I'm thinking, I haven't changed jobs or searched for a job in a long time. But here's my first thought. I would try to visually manage everything that was taking place, because you can think of applying for a job and getting interviewed and going through and maybe getting hired as a value stream. So I'm thinking of methods like personal Kanban, Post-it notes on the wall, or use a Kanban system like Lean Kit Kanban or Trello. And I would track where these different, think of it like a sales channel. You're selling yourself to an organization. You have leads, you have opportunities. And I think visual management would help make sure you don't forget, to follow up on something. That would be one lean principle I would try to apply. There's going to be a lot of delays where you're waiting on the hiring organization, but I would try to use visual management just to keep that job search kind of in front of me and manage it that way. What are your thoughts, Greg?
Well, my first thought is we're hiring at KaiNexus. We're looking for a customer success person to work with all of our customers. We're kind of in an explosive time here. So that's my first thought. If you're interested in, and you're presumably interested in living in Austin, our customer success team is based out of Austin. Please reach out to us on our website. We have a form there.
KaiNexus.com.
KaiNexus.com. The second thing I would say is I think and it's something that we're doing here also on the kind of the other side of that. But every cycle that you're going through, every time that you finish an interview, you should kind of reflect and think, okay, what did I like about what I said? What did I not like? What could I do better in the next? And so I would kind of not emphasize the tactical part that I think Mark did really well. I would simply emphasize, your resume or your CV. That's not a static document. Always be looking at it, sharing it with other people, getting feedback, and be iterative about what you're doing. Because that cycle, you could almost break it down into a daily cycle as you're going through all these different leads, if you will.
Yeah. So the opportunity to apply continuous improvement practices. Yes.
And it can be done very informally. I mean, I don't think when you're doing it by yourself, you don't need to log an opportunity for improvement in. You can just kind of do it and see what happens.
Yeah. So here's a question from Christina. She works in healthcare. When implementing a culture of improvement, how do you help people manage all of the activities and change that's going on, especially at the beginning when there's a flood of ideas and you want to avoid change fatigue? Let me just make one comment. There may be a thing called change fatigue. I really have not seen improvement fatigue. So I think change fatigue, to me, change tends to be more imposed on you by leaders or outside forces. That can get exhausting because I think there's kind of a lack of psychological control over the situation. But just this past week, I was at Franciscan St. Francis Health System in Indianapolis. My co-author, Joe Schwartz from the Healthcare Kaizen book, that's his healthcare organization. They've implemented 27,000 improvements now since 2007. And when you talk to staff, you talk to managers, there's no such thing as improvement fatigue because it's their ideas solving problems that matter to them. And it creates this positive reinforcing cycle of improvement and recognition, and it makes your work easier and you want to do more. So that's one way I would maybe reframe the question. How do you shift from change to improvement, that instead of being done to people, it's something they're actively involved in? But what are your thoughts, Greg?
Yeah, Mark, do you mind repeating the question? Because I heard one question and then I feel like you took a different angle on it.
Well, so they're saying basically, how do you manage all of the change? At the beginning, there tends to be a flood of ideas and you're trying to avoid change fatigue.
Right, so you're really picking up on the word change fatigue. I'm going to pick up on the word manage. And I would be remiss if I didn't say that, that is one of the primary things that people come to us at KaiNexus to do, to manage all of the information. We built a continuous improvement platform to do exactly that. And I think that whether you're just starting out or whether you're been doing this for years and are just buried in Excel spreadsheets and Word documents, I think we can provide value on that. But if you decide not to come and take a look at KaiNexus, then my recommendation would be to make sure that it's done in a collaborative way, to make sure that it's done in a transparent way, and then just the simpler you can make it, the better.
Yeah.
One of the things that we're constantly recommending to our customers is to decrease the complexity of the system that you're trying to do continuous improvement in.
Yeah, and one other point I would make, when there's a flood of ideas coming in, I think one strategy to avoid burnout or delays, is to avoid resource utilization. That's 100%. Don't have all ideas flow to the manager for implementation. Don't have all ideas flow to a Kaizen coordinator for implementation. When you're asking people to point out problems and to solve problems, then you spread out the improvement work. That helps eliminate bottlenecks. Have everybody working on small improvements instead of trying to channel it all through one person. Easier said than done, but I think that's what you need to do.
Great.
All right. So, that is our 30 minutes here. It always goes so quickly. We addressed a number of great questions today. I think we'll do another one of these in May, episode 7. We'll sign, if you're following me through Blab, you'll get notified. I would encourage you to follow us through KaiNexus. Go to KaiNexus.com/webinars. You can sign up for our newsletter and we'll let you know about these future sessions and the recordings are all on YouTube. So thank you for joining us, Greg. Do you have a final thought to wrap up?
We have some very exciting stuff going on our website that will likely either be coming out at the end of this week or the beginning of next week. So if you haven't been to our website in a while, please come check it out, because you're going to be blown away in about a couple of days. We're going to be doing something very exciting.
The big teaser. And I'll plug one more thing. We're doing a more traditional webinar on Tuesday, April 19th with Michael Lombard, talking about lean management systems in healthcare and how they've been incorporating the use of KaiNexus software into that. So again, go to kainexus.com/webinars for more information and to sign up for that. So
that is going to be a absolute fantastic webinar. Michael Lombard is doing some amazing things at Cornerstone, and he's going to talk a little bit about what they're doing. Truly, I think, creating a exemplary environment, if you will. So I would we're all going to be sitting in on that webinar, because it's just some really exciting stuff.
Yeah. All right. Well, thanks everybody for joining us, and thanks for watching the recording if you're seeing it later. Greg, we'll talk to you soon.
Thanks, guys.
Bye.